Hello, welcome to my YouTube channel. My name is Megan and I'm really glad that you're watching this. This video is an update on my journey with Prolotherapy. I am currently a patient at Caring Medical in Florida, and I guess I am no longer, but I was receiving regenerative medicine on my cervical spine to treat craniocervical instability and atlantoaxial instability. I had ligament damage and was receiving prolotherapy to tighten the ligaments. This past week I had my 6th round of prolotherapy, and I'm hoping that it is my last, but I just wanted to update you guys on my improvement and how it's going, especially if you are considering regenerative medicine for the same conditions and are watching my journey to see if it works or not. So that's why I'm doing this. First and foremost, I just want to say that I'm doing very well. I am just so relieved with my improvement so far. What Dr. Hauser says, my prolotherapist, is that prolotherapy isn't instantaneous. It takes time to work. The healing takes time, and so I know that my body is not done with the healing process. I should continue to see improvement over the next several weeks and months, and so knowing that the healing process isn't over and seeing how much I have improved has been incredibly encouraging for me. Along with that, I will mention that in about 6 to 8 weeks, I am going to get new imaging done on my neck to see where my vertebrae are and see the level of instability I have. And when I get that imaging done, I will give another report. I will do another YouTube video on my improvement and my progress, and I will know at that time for sure if I am going to receive any more treatment on my neck. But in the meantime, I wanted to share how I'm doing. So I was going to go through my very long list of symptoms, but it's over 30 plus symptoms long, what I used to experience on an average day. And so I'm not going to at this time, but if anyone really wants to know, then I will do that in my next update video. But one thing I did want to mention is a lot of people have been asking me about my POTS, which, if you don't know, stands for postural orthostatic tachycardia syndrome, and have been asking if it's improved. And I just wanted to say that yes, my POTS is much better since being treated with prolotherapy. To give you some context, in February 2021, so this year, at the end of February, I had a Nasaline test, which is a diagnostic for POTS, and I was positively diagnosed with POTS. I'd been diagnosed before, but had just received another test, and to gauge where I was at during this time with POTS, if you're familiar with the test, you lay down for 10 minutes and you measure your heart rate and a couple of other things, and then you stand up for 10 minutes and lean at a very slight angle against a wall, and your blood pressure and your heart rate are supposed to stabilize and be normal. But if you have orthostatic intolerance, they will not be normal, and your heart rate will elevate, I believe, over 30 beats, but I'm not positive on that, so don't quote me. And some people will pass out. I passed out during my test. But if you're curious to know how bad my POTS was, so my resting heart rate just on a normal day is about in the 40s. I have a low heart rate. I'm an endurance athlete, so that's normal. But during my Nasaline test, when I was laying flat, my heart rate was at 54, and then upon standing, in the first 5 minutes of literally just getting up and standing against the wall, it was elevated to, my pulse was elevated to 105. And by the time I hit the 5th minute, I experienced syncope, so I passed out. And then the physical therapist who was doing the test caught me, luckily, and laid me down on a medical table. And right upon laying down, my heart rate stabilized and I felt fine. So I tested positive for orthostatic intolerance. Long story short. But all that to say, now only a handful of months later after having prolotherapy, I rarely, if ever, get dizzy upon standing or posture change. I don't have to wear my compression socks or my abdominal binder. I used to wear that to be able to somewhat function. And just all of my POTS symptoms have been greatly reduced, which has been a huge relief. So if you have really bad POTS, it might be because of cervical instability, might be worth getting testing done. And if you have cervical instability and you also have a POTS diagnosis, if you're like me, then your POTS symptoms may increase, which is encouraging. Upon receiving treatment, they may be alleviated. So I want to mention that. And yeah. Oh, another question that I have gotten a lot is, why have I opted for prolotherapy instead of PRP or getting stem cells? And why that is because my prolotherapist, Dr. Hauser, wanted to start out with prolotherapy and see how that went, and I responded really well, so we just stuck with it. The plan always was, if prolotherapy wasn't working, then I would switch to platelet-rich plasma, and if that didn't work, then I would switch to stem cells. But luckily, prolotherapy has done the job for me. So that is primarily why. Also, another reason why I did not choose to go the platelet-rich plasma route is because I got platelet-rich plasma on my lower back and my hips. I have some instability there, and I did not react well. I'm not sure if that's just because I had a lack of mobility for a time, and that decreased my ability to move and exercise, which is really important for me and my quality of life. So I'm not sure if it was that or if it was the PRP itself, but I had really heavy flares and onset of symptoms after receiving PRP on my lower body, so I didn't want to risk it on my neck unless absolutely necessary. I'm not exactly sure why, but that was just the situation for me. Another thing I wanted to mention is when deciding upon regenerative medicine, not even just prolotherapy, but regenerative medicine in general, I was also consulting with neurosurgeons. I had seen 4, and there's one neurosurgeon in particular who specializes in fusion for craniocervical and atlantoaxial instability, who cleared me for intracranial, who cleared me for ICT and pressure bolt testing, who thought I was a great candidate for fusion surgery. So that was an option for me in a route, but now seeing that I just decided not to, because that is a permanent change to your life, and I've heard some horror stories. So I decided to not do the neurosurgery route unless it was my last possible option. And looking back, seeing that regenerative medicine has been successful for me is extremely encouraging, and I'm really glad I did not first choose to go the neurosurgery route. So if you're waffling between the two, that might be helpful. I know that not everyone can just try regenerative medicine and see if it works before trying a fusion, but I thought it worth mentioning because I know fusions often are life-altering, and they don't always help everyone. So I wanted to mention that. What else? Oh, okay, so another thing I thought worth mentioning is so it's a bit controversial, but I do have a Lyme disease diagnosis for what is often referred to as chronic Lyme. Like I said, it's controversial, but this diagnosis might point to the fact that I have Lyme disease, and it may have contributed to the weakening of my ligaments and ligament laxity, and why I ended up getting an unstable neck. But I'm not absolutely sure. I have a Lyme literate doctor who I'm currently seeing, who has ordered a bunch of testing for me. I already have Lyme testing, but I'm just getting more done. And so after my neck completely heals, I'm going to make the decision if I'm going to go through Lyme treatment. I know it's one of those cases where you get worse before you get better, and it's a long and grueling process. So I'm not exactly positive yet if I'm going to do that, but I thought it worth mentioning because I know some people have Lyme disease and or might have Lyme disease and are wondering why they have ligament laxity to begin with. So at my next update, I will let you guys know if I have decided to go through with that. I hope all is well. If you have any questions, let me know. I'm more than happy to answer them. And I will try to upload a couple more helpful videos before I do my last, hopefully, prolotherapy update in 6 to 8 weeks.